Namaskar, hello and welcome to Sansad TV. I'm Tina Jha. In Perspective today, we are going to talk about vaccine hesitancy, a concern that resurfaced following the events of the past week that witnessed a high-profile legal fight in Australia over star tennis player Novak Djokovic's vaccination status. Djokovic had to be deported after he lost the visa battle on grounds that he was unvaccinated and did not fulfill the criteria to participate in the Australian Open tournament. The incident has brought forth different viewpoints, one which argues against vaccine mandate, saying getting vaccinated is a freedom of choice, and this is what supporters of Djokovic worldwide have also been asserting. While the other viewpoint is that vaccination is the only and the best way to end the pandemic and the global misery that it has caused, the larger question is to end the pandemic wherein no one is safe until everyone is safe. How relevant and strong are the arguments on freedom of choice? How is the fight against this global crisis impacted when prominent figures assert on making a choice contrary to global good? And amid the raging pandemic and the persistent threat of future waves, how can vaccine skepticism and hesitancy be addressed worldwide? We'll try and find answers to some of those questions on our show today with a distinguished panel of experts. So let me first introduce them to you. I have with me on the program Dr. Sunil Raina, advisor, World Health Network and COVID Action Group. He's also an expert member, Global Outbreak Alert and Response Network, World Health Organization. Dr. Mekhla Chandra, senior consultant, Department of Internal Medicine, Sutter Medical Center, Sacramento, California, USA. And Dr. Shashank Joshi, he's a member of the COVID-19 Task Force, Maharashtra. Thank you to all my guests for joining me on the show today. Dr. Raina, let me begin the program with your response first to the whole Djokovic deportation saga that took place in the past week over him being unvaccinated and the larger debate that it has opened up between those who are vaccinated and those unvaccinated worldwide. Also, the larger question, in the face of adversity, such as the ongoing COVID pandemic, wherein no one is safe until everyone around the globe is safe, how strong and relevant are the arguments of freedom of choice?
First, thanks, Tina, for having me on the show. And this is absolutely relevant in the current times. Now, we are seeing what's happening around us. We have a population or a group of people who have the access to vaccines, who have access of vaccines, and the number of vaccines available with them is more than what they need. And then there we have a population wherein the availability of vaccines is minimal. Despite this fact, the people who have the vaccines, therein we find the presence of hesitancy. So maybe in that sense, this is not just important, but also sparks of a debate that wherein we need to search for a parity between hesitancy versus equity. Now, when you talk of this star player, when he talks of his own freedom of choice, he also needs to take into account the freedom of choice of all others around whom who are battling this pandemic.
Absolutely.
We agree to the fact that this vaccine that are being rolled around across the world may not prevent us from infection. So in that sense, having a choice of vaccination may be important. But the fact is that if I am infected and if I am capable of transmitting this infection to somebody else, I'm robbing him of his freedom of choice of living a life free of the pandemic, free of the disease. So in that sense, we are not just answerable to ourselves, we are also answerable to the people around us.
Dr. Joshi, when popular figures, and especially those who have a large number of followers, fans worldwide, somebody like Novak Djokovic, and when they assert on making a freedom of choice of not being vaccinated, of asserting that this is their freedom of choice, how damaging is it for the global campaign in a year, especially when we are trying to get out of the pandemic?
The question is that, in this year, we are seeing that there is a large explosive tsunami like Omicron outbreak across the world. And it is very sad to notice that the unvaccinated population in US and Europe are driving deaths there and driving severe disease there, where healthcare infrastructure is completely overburdened and overwhelmed. If you see South Africa, if you see India, a large proportion is still vaccinated. And we are seeing a milder form of the disease. Our hospital beds, even in the current tsunami-like wave in a city like Mumbai or Pune or New Delhi, are still empty 80%. So you can see that vaccines, though as Dr. Raina rightly mentioned, may not be preventive vaccines or sterilizing vaccines, they clearly save lives and they clearly save you from severe disease. It is important that most of the people, most of the time, need some immunity booster, and vaccines currently, which are early generation, are doing that job. So if you do not subscribe to this, it is not a correct thing to do, and it sends a wrong signal. We all live in a common village, common world. And as you rightly said, that we want to ensure that everybody across planet Earth needs to get that vaccine on board. And the unvaccinated population is the one who has not got any exposure. So it is the unexposed population which is really the one which is most vulnerable apart from the vulnerable groups. And if you're unvaccinated and you are senior citizen or you are in a comorbidity or immunocompromised group, then your likelihood of death or severe disease is high. Currently, if you see, Omicron, though, has a less severe disease. Our goal worldwide now is first, every life is precious and we have to have zero COVID deaths. Second, we need to have minimal severe deaths. Third, we need not burden our healthcare infrastructure. And fourth, then move in a COVID safe environment. And in that, apart from mask and air ventilation, vaccine is one of the most important tools in that direction. And that is why the need for vaccination, and particularly by role models, should show this route. And I do not think such type of hesitancy helps that cause in any way. And they should be also mindful that every human being is also equally responsible in their behavior towards the community, which has made them what they are.
Absolutely. Dr. Chandra, so vaccination is perhaps the only and the best way to end the pandemic. But, and also we are fortunate that we got access to COVID-19 vaccines within the first year of the pandemic. But when incidents like these happen, when celebrities, popular figures of a stature of Novak Djokovic, and there are others as well worldwide who have been, in a way, propelling vaccine hesitancy concerns, and it damages the global campaign as well. But if we try and understand the reasons behind this vaccine hesitancy, the skepticism, so in low-income countries, we can say that there aren't enough access to, awareness campaigns, there aren't enough information systems to quell the various queries of people. But in countries where vaccines are not just available, but they're also in abundance, what explains the skepticism and the hesitancy of what we are seeing in countries like USA, in several European countries where there are protests against vaccine mandate?
I think that's a great question. So first of all, what is exactly hesitancy, right? So hesitancy is when you don't want to take a vaccine which is available in abundance. So countries like Europe, US, we have abundance of vaccination. That is not our problem. And why are we not taking it? 30% of US population is still unvaccinated. As a healthcare provider, this is just mind-blowing to see that you're living in a developed country and you see this in your patients. So why is this? And there's been few studies, research about it. And I think the most important thing is these conspiracy theories, which are overblown on social media. We weren't that well connected maybe a decade ago, but now everybody has a sob story on WhatsApp, like somebody got a COVID shot and died, and now it's all viral on WhatsApp, social media, Facebook, etc. So that kind of negative publicity is what's going against our global campaign. People believe that they have exemptions because of religious, philosophical reasons, and that's just propaganded in a negative way again. Because of all this availability of your internet freely. So that's why you're seeing this vaccine hesitancy more in developed countries, I would say, ironically, rather than lower income countries developing.
Yes, then the problem is enough vaccines aren't available.
The access to negative publicity. We're trying our best to have this global campaign, reach out, do pop-up clinics, make vaccines available in developing countries as healthcare providers, as policymakers. But somehow, negative news travels faster than positive news, if you would just put it simply like that. So I think that's probably the answer to your questions, no matter how much our positive efforts are. This whole non-scientific based spread of negative impact of vaccination is what's causing and damaging our current policies.
Absolutely, and very, very concerning, Dr. Raina, because in one of the news stories that I was watching, in Germany, there is a section of population which has begun to emigrate to other countries because there is vaccine mandate in their home country. And if this continues worldwide, of course, it's going to be a cause of concern, because we are trying to propagate to the world that vaccination is the only way to end the pandemic. And now that we are in a situation wherein there is opposition to vaccine mandate, what is the solution? How can we quell this misinformation which is flying thick and fast through social media, as Dr. Chandra pointed out? How can the world unite to quell this misinformation campaign?
I think the perfect way of dealing with this misinformation campaign is the way we dealt with other things in this pandemic. So we have to be scientific, and we have to communicate to people the risks, the benefits, everything about vaccination itself. The unfortunate part with vaccination has been that the pace and the development of vaccines was rapid, but the information, the misinformation with regard to vaccines traveled much more faster. So when this misinformation became a part of public debate, hesitancy rose. Hesitancy also rose because of the fact that people over a period of time realized that they didn't trust their systems, they didn't trust their governments, they didn't trust the healthcare delivery people who are delivering these vaccines. As also the fact that there was flip-flop on part of the governments or institutions who were advocating vaccines. So for example, if you take an example of Europe, they never ever had a complete policy on vaccines. At one point in time, they suggested that immunity can be achieved through infection. At the other point of time, they said that no, we need to shift to vaccines, and COVID-appropriate behavior may not be the answer to this pandemic. So this flip-flop has only accentuated what may have been communicated by misinformation as far as this pandemic was concerned regarding the vaccines. So probably what needs to be done is that developing a concrete system of information, reaching out to the people who are to receive vaccines will be the key. And in that sense, in developing a system of presumptive information, wherein we are able to tell people, look, there are 2 doses of vaccine that are required to be given to you. You are required to receive these in timely manner, may be the answer. Unfortunately, we have not been able to develop this presumptive information from the way we started our pandemic. In the beginning of the pandemic, we were not very sure with regard to what we were talking of with regard to vaccines. So when we talked about this being able to control the pandemic, we didn't tell people that this will control infections. This may not control infections. This will control death only. So in that sense, we have to be more proactive as far as the information that travels to people, the information that reaches to people, as also the fact that we will need to increase access. If we are able to increase access across the globe, the chances are that we will be able to quell hesitancy in the areas wherein the vaccination is not there.
Yes.
Because what happens most of the times is that when you see, for example, you see South Africa. Now, South Africa, when it was not in the midst of Omicron, it was thinking of vaccination. It was launching vaccination to a huge level. It was in the midst of a good vaccination drive. But once Omicron overran it, it stopped vaccination. The number of vaccinations being given there has reduced. Or you look at India, once Delta was ravaging us, we were very much in for vaccination. But once Delta started going down and Omicron came to us, our own willingness to get vaccinated has dropped down. So probably developing a comprehensive strategy that informs people, tells them that vaccination is beneficial, not only at individual level, but at the global level, at the community level, is the way forward. And that information needs to be distributed through good domains, which are public in nature, but are controlled well enough not to spread misinformation.
Okay. Dr. Joshi, fortunately, there is very low vaccine hesitancy this time around in India. Only about 7% of the people are hesitant, and because of reasons, because of their lack of faith in science or due to religious beliefs. And there are efforts to quell this kind of mistrust that they have in the system. But nevertheless, the worry is that even if we are able to vaccinate a significant population, we will be under threat if variants continue to emerge in any part of the world. And that is where the impact has to reduce of this vaccine hesitancy that is being witnessed worldwide. So what is the road ahead then? There are some measures that Dr. Raina has suggested, but from an Indian perspective.
From an Indian perspective, you are absolutely right that we still have a small number which in the adult population which is totally unvaccinated, and a reasonable number which has not got their second dose. We need to ensure that that vaccination is completed first. Then we also are now having extra or precautionary doses in the people who are exposed to the virus all the time, like healthcare and frontline workers, as well as people above 60 who might have comorbid conditions which need a dialogue and discussion with their doctor. We have also identified a cohort of 15 to 18 years in our adolescent population, which is the exam going pool of 10th and 12th standard, which is also being vaccinated. All these pools need to ensure that we complete the process of vaccination. Beyond that, we have to also look at children between 12 to 15, and that will also start. Initially, we had challenges related to availability of vaccines and production of vaccines. But now what has happened is that India also has developed a large pool of different Make in India, Made in India vaccines. And we will have a larger plethora of choice of vaccinations with us, including our own Make in India mRNA vaccine. So the platforms, the type of delivery, the access, everything is in place. There are still remote rural geographies as well as some urban ghettos which still are hesitant and are totally unvaccinated. We need to focus on that, ensure that we complete that last mile so that we at least have our adult population fully vaccinated with 2 doses, and then look at the next zone of vaccination. I think it is doable, and you are absolutely right that we need to set an example. See, when we started, US, Europe was far ahead of us because they had access to mRNA platforms, but they are now struggling with a Delta and Omicron dual jeopardy. While we can see that even though we are hit by a tsunami in major metropolitan cities like, say, Mumbai, Delhi, Calcutta, Chennai, we still are reasonably we are not in a zone where hospital infrastructure is under strain. Yes, healthcare has taken a little bit of hit, and non-COVID care and COVID care still continues. And that is the success of our vaccine story. To vaccinate 150 crores and being the vaccine pharmacy of the world, I think we have shown the world that we can do it, but we should not be complacent. We should continue this process. We should continue the next level of our precautionary doses, our pediatric vaccination program, our adolescent vaccination program, as well as ensure that everybody in India gets their second dose on time, appropriately, and correctly.
Absolutely. But success in defeating the pandemic, Dr. Chandra, can only be achieved when a significant population worldwide is vaccinated. So we talk about vaccine equity. We talk about how there is need to make people more aware of getting vaccinated and double dose that too across countries. But the larger concern will always remain that despite vaccines being available, there is a group of people which is asserting their freedom of choice of not being vaccinated and riding on this misinformation campaign that you witnessed. Is there a fear that this unvaccinated group could drag the pandemic longer than what is otherwise expected?
Absolutely. Absolutely. This battle has been ongoing. Right now, we're talking about COVID vaccine, but to, go back a few decades ago, still struggling with measles vaccination in children. We aren't able to eradicate polio, but these are like minor examples now because, we have a bigger picture to look at here, but we were able to eradicate things like smallpox just by coming together, So these are small examples that people really need to look up at. They need to think that science has evolved. We were able to develop these vaccines really fast because our genetic surveillance is improved, our technology is super improved. So just because it's like developed in short term doesn't mean it's less efficacious. I think that's the first fear in people that, how can they develop a vaccine within like few months? It must be pharma, some kind of like money-making scheme or like this is like a bioweapon. When your CEO of a vaccine company is commenting that, it's a huge thing. These people have social responsibilities. Not only responsibility, they have social obligation to create a right picture, create scientific evidence when you're propagating and promoting these kind of medications and vaccines. This changed the world. We were able to prevent so many deaths because of vaccinations from Delta variant and now upcoming Omicron. One of the reasons Omicron may be less severe is because most of the world population is vaccinated. So people need to look at this. People need to look at scientific evidence. As Dr. Rana mentioned, chaos, confusion, this is what's also creating this havoc over there. There's no policy regulation. like I advise for certain international companies, and our main goal is, it has to be uniform. Everything has to be implemented uniformly.
Sure.
It has to be a strategic implementation. So these things, people need to look at this. Enough evidence. So these anti-vaxxers or vaccine hesitancy, they are going to prolong the pandemic, unfortunately.
Dr. Raina, the World Health Organization describes vaccine hesitancy as a top 10 global health issue. It has been prevailing for long due to multiple factors that we have discussed on the program. But in order to quell it at the moment so that it doesn't continue even in future and does not continue to prevail, the anti-vaxxers argument, which is contrary to public good, does not prevail even in the times to come. What are the initiatives that the World Health Organization can take or is taking?
I think the World Health Organization is seized of this thing, and in fact, as you rightly pointed out, they have listed it as the top 10 health concerns that are going to confront us. But if you look at the hesitancy against vaccines is not a new phenomenon.
Yes.
In fact, if you look at what has happened in the past 20, 30 years, since the scam that came up with Wakefield's argument with regard to MMR and autism, there have been huge debate that has been going around the world circles on hesitancy and the role of vaccines, that is the role of vaccines with regard to certain diseases. But the fact is that what WHO and what all of us we need to do is that we need to strongly confront this misinformation. We need to provide evidence. And the best thing about evidence is that we probably need to wait a bit. We need to tell scientific community across the world not to jump the gun. What is happening with most of the things with regard to vaccines is that whether positive or negative, most of the information on vaccines is coming out far too sooner than it is expected to come out. For example, if you look at the past, the problem with AstraZeneca vaccine that surfaced in some parts of the Europe was reported very, very, very rapidly, and it did create a sense of scare with regard to all those who were supposed to receive AstraZeneca. So probably scientific community also needs to be patient, and those who are in the business of information or who are in the media network, they also need to be careful as to what they need to tell people, because ultimately people listen to these public debates, and most of the misinformation or hesitancy is an outcome of public debates. So whether information, good or bad, it is available in public debates, and it's for the people how they pick it up or don't pick it up. So probably creating a right atmosphere for public debate and asking people to maybe slow a bit, be a bit patient, and analyze what is being served to them in terms of information will be the key. And WHO is at the forefront of that as well. It's not just WHO, it's all our own institutions in India who have been talking of these myths and facts, how to dispel those myths. There is all enough of literature which is available in the public domain on this. The key is, or the way forward is to transfer this information to the public in general and to the people who are against vaccines in particular, because that is what is going to help us in the long time.
Absolutely. Dr. Joshi, how can we further strengthen our information systems which addresses concerns of people adequately? So far, we've done good, but the limited number of people who refuse to get vaccinated and to get them on board as well to ensure safety for the entire population, what is the scope for improvement?
There's a lot of scope for improvement. I think information dissemination is the key, and the right information about adverse events. What happens is if there is an unfortunate adverse event, for example, recently in Mumbai city, one girl died and it was all attributed to the vaccine she had taken, which was not true at all. A lot of people have underlying comorbidities. So it is how the information is distilled and put out in the media. And media also needs responsive reporting. And that is also an important part of the whole dissemination exercise. I think it's important to recognize that, vaccinations have been around for some time. For example, in the pediatric space, we give our children from the day of the birth till 5 years regularly vaccines with our pediatricians. These vaccines are as safe or maybe safer than those pediatric vaccines. So we need to keep on harping that fact.
Yes.
Second thing is, suppose we are having a simple wound, we take a tetanus toxoid. Or if we have a dog bite, we go and take a rabies immunoglobulin or a rabies vaccine. So when we are not hesitant there, why should there be a hesitancy? This is not some common cold or a simple flu. This is a COVID which can take life. This is a COVID which may have severe disease where you may need oxygen or ventilator. And therefore, it is important to recognize that we need to boost up our immunity. And this vaccines, all vaccines all over the world have gone through the filter of a safety profile. So in consultation with your doctor, there is no harm going ahead and getting vaccinated. I think that is the right way to do it.
Absolutely.
Unfortunately, on social media, whether it's a doctor WhatsApp or a doctor Google, it is not peer reviewed, it is not evidence based, and it is based on speculation. And speculation, if it is informed, it is still reasonable. Most of these are wild speculations, and these wild speculations lead to rumor mongering, misinformation, and it actually is deleterious to the whole process of a post-COVID world.
Certainly, and it's very, very important to end
or living with COVID. It is very, very important to do it right and ensure that we dispel all these myths which surround vaccination, which are completely unsubstantiated, unscientific, and incorrect. What is scientific and what is appropriate is already there. There are regulators in place all over the world. US FDA is one of the toughest filters. So is Europe. And even Indian FDA, I'm very proud of the Indian FDA that they are, the DCGIs and their subject expert committees are very thorough in their analysis in getting out vaccines. And vaccines also which are available, like a killed vaccine like Covaxin. I don't see any major challenges with that. We see the number of people in India who have got Covishield. So it's important to recognize that vaccines, when they are to be given, we need to instill confidence in people who are going to take them, and therefore scientific, science-based information. And if an adverse event occurs,
absolutely, and to keep reiterating the fact that vaccination is the best way to end the pandemic, and the sooner the better it is for the world, looking at the misery it has caused for all of us across the world. So with that, I'll have to call it a wrap on this edition of Perspective today. Thank you once again to all my guests for joining me on the program today, sharing your thoughts with us and our viewers. It was a pleasure having you on the show. So that's it from us on Perspective today. Thanks very much to all our viewers as well for their time.